Welcome to this edition, the Saturday edition of Integrative Movement Insider. Thanks so much for joining us. And I have a question for you. Should you teach your clients that have chronic shoulder issues and or neck tightness and or that forward shoulder position, should you teach them to bring their shoulder blades down and back as we've all taught? And if so, why? Because we often get taught, or we should have, I should say, most of us have been taught that when you have a forward shoulder position, that things out here are short and tight and things back here are weak and loose. So therefore we need to teach our clients to squeeze back and down as if we're putting the shoulder blades into the back pockets. Now, for some of our clients, this may be an appropriate training cue, meaning it may be a good proprioceptive way to teach your client how to move their scapula and to understand that their scapula can actually move back and down as well as forward and up. However, most of your clients that struggle with chronic tightness in their shoulders, as we've discussed in the previous 2 episodes of Integrative Movement Insider, so if you missed them, check those out. Most of our clients actually struggle getting their scapula to come around, to wrap around the ribcage, and to stay snug up against the ribcage to create optimal upward rotation and posterior tilt of the scapula. And that's why if we bring our shoulder blades down and back and we keep them there, do this with me if you're watching me or watching this at home, bring your arms up while retracting and depressing your scapula. And you know that does not feel well. So what happens for our clients is they will go through a pushing or eccentric motion of a row and their scapula will come out and then they'll retract them back and then they'll let them go and then they'll retract them back, or they'll just keep them back and they just do this little small motion like this and excuse me, and they're actually just driving their humeral head forward. So they're actually not improving the alignment, and more importantly, they're not improving the control. Yes, they are stabilizing their scapula. But the problem with stabilizing the scapula is it shouldn't be locked down and back. It needs to move around the rib cage. So this is exactly what we discussed in a conference call that I just had with my Integrative Movement Specialist certification team. They're going through module number 3 of the 4-module program where we discuss shoulder mechanics. And this is why it's so important that you understand functional anatomy. Because we understand that the rhomboids and mid-traps will retract and the low traps will depress the scapula. However, is that what they actually should be doing during motion? And I'll argue that no, they're not. What their job is to do is to stabilize the scapula upon the rib cage. So if I turn around this direction, pretend that my hands are the scapula, when we're rowing during a pulling motion, or doing a pulling motion, the scapula should retract but not come all the way together like this. So we should not be doing this as pinching our shoulder blades together as we've been taught, because this is not optimal mechanics. And if you don't believe me, just check out a baby. Does a baby ever fully retract their scapula? Do they ever pinch their shoulder blades down? Do they ever lift their chest up? Not happening. And again, when they're reaching out in front of them, do they ever excessively go like this? No, they learn, or they should say they develop the awareness of being able to wrap the scapula around the rib cage. So let me show you how we set our clients up during a couple easy and common rowing patterns. So I'll use a band resisted row pattern. And it always begins with alignment, because the alignment of the head, neck, and thoracolpelvic cylinder, so that first rib down to the pelvis, is what sets up optimal scapular alignment and control. So we always start out with a long spine position, the rib cage stacked in a line above the pelvis, and then we grab the resistance. We don't try to grab the resistance and then align. So now we just step back. So now I'm set up. And now what I do is I just pull and I'm rowing so that my elbow stays relatively in line with my shoulder. So I'll come around here a little bit more. Hopefully that's still caught on camera. And then I release to control the eccentric. So it's not this and it's not this. It's just maintaining that nice alignment, keeping the space in between the upper arm and the body, not teaching the client to excessively pull down and back. I'll turn around so you can see it from behind as well. So again, we're going to align, keep the shoulders open and wide. That's the cue we use most frequently. So into our squat position if we're doing a standing band row, and then pull and maintaining that open and wide position, not squeezing down and back and not lifting the chest up as I'm doing now, which is basically just over compressing my back. So again, it's a long spine, row, keep an open, wide shoulder position, maintain that thoracolpelvic cylinder alignment, control the eccentric phase of the exercise pattern, and that's how you do a row, whether you're doing a standing, more horizontal type row, If you're doing a bent over row, it's the exact same position. So it's just here, stack and align that thoracolpelvic cylinder, hinge, and now it's just a bent over row like this. If you're doing a split stance row, no problem. If you're doing a supported row, same idea. You're still maintaining that same alignment. You're still teaching the client how to maintain control, alignment and control of the scapula upon the thorax. And that's optimal scapular mechanics. And that's how you'll help so many of your clients that have chronic neck, shoulder, as well as upper back issues, those chronic trigger points, and the feeling that they always need to release or get massage or have somebody stick an elbow in their neck. All that comes related to, or should say secondary to, non-optimal alignment and control of the head, neck, and thoracolpelvic cylinder. So the more you know, the more you can help your clients and attract more individuals that need, want, and will pay you for your expertise. So this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Thanks so much for joining me on this edition of Facebook Live. If you're looking for more information, check out the Integrative Corrective Exercise Instructor Certification Program. We got a course coming up next week in Reston, Virginia, and then in 4 weeks in Boston, where day 2, we go through the entire functional anatomy, biomechanics, and motor control around the shoulder. We teach you the most effective assessments, corrective exercises, and how to integrate this into the functional movement patterns and program this for your clients that struggle with chronic neck, shoulder, and upper back issues. And we teach you how to leave with the integrative movement system, a proprietary system to help you be the expert for your current clients, differentiate yourself in the industry, and help more individuals, attract more individuals that need your expertise. And also, next Tuesday, I'll be on a webinar with my friend and colleague, Robert Linkle, where he'll be interviewing me about the shoulder. And I want to share with you the 2 most effective assessments that we use with our clients. We've shared one of them with you already here, forward flexion of the shoulder. This is one of our go-to assessments. It's also one of our go-to checks. So that you can check your results by using overhead flexion. I'll show you how to do that on the webinar. And I'll also share with you our 2 best corrective exercises and how to integrate this information into the fundamental movement patterns. And we'll go in depth in this hour-long webinar. It's only $15. You can go to his website, Robert Linkle, L-I-N-K-U-L. The link is next to this video, depending on above or below, depending on where you're watching it. Look forward to seeing you on the webinar. Look forward to seeing you at a training soon. So keep doing what you're doing. Empower your clients, educate your clients, and help them excel at their greatest level, or to their greatest level. Thanks so much for watching. I'll see you next time. Happy Saturday.